and welcome to the Dr. Cassie Show. Today we have Caroline and her daughter Judy, who was one of the first pediatric patients to receive a new type of cataract surgery. Previously, cataracts was treated by taking out the old cataractus lens and replacing it with an artificial lens. But even in children who had cataract surgery, they would still need some type of visual aid like contacts or glasses when they grew up. So researchers wanted to see if they could create a new type of way of treating cataracts by using epithelial stem cells to reform the lens, and they did just that. Caroline, why don't you tell us what made you decide to do the new pediatric cataract surgery?
So when my child Judy was 1 year old, she had cataracts, which is clouding of the eyes, and I was really scared because cataracts are the leading cause of blindness, and we didn't want to use the current treatment because of all the complications and because we couldn't use the artificial lens since children under 2 years old don't have a fully developed refractive power. So we went to the doctor and they advised us to try this new treatment using regeneration of the lens using stem cells. And I was really fascinated with the study.
Currently, my eyes feel perfectly fine, and I don't remember much of the surgery, but there's no pain, and I can see perfectly fine, and my eyes feel natural, as if I never got surgery.
So what made you really decide that this was the surgery you wanted to do when it was brand new and there could have been risks?
Well, the statistics just, are significant. I think it just proves itself why it's so, why it's such a great
option.
Yeah. The thing that sold me most was the promise of such high visual axis transparency. Also that the lens epithelial stem cells would allow high proliferation of LECs, and even after the eye is injured. The doctors also promised that this would continue onto adulthood, and that's really key to preventing cataract formation again, and it also helps with lens regeneration.
I would recommend this treatment plan because I have great visual acuity and there is a lower chance of having inflammation and complications with the new minimally invasive treatment compared to the current treatment of artificial lens, which shows that this surgery is safer. And this new surgery is also less invasive. You don't see a scar in my eyes unless my pupils are dilated.
Awesome. So we actually have Dr. Maya, who performed the surgery on Judy in the house today. So we'll talk to Dr. Maya, see what she has to say about the procedure, the risks, how they found it, and all the good stuff.
Hi, Dr. Cassie. Thank you for having me here today. So cataracts is the main cause for infant blindness today, and the most commonly used practice is the removal of the cataractus lens through a large opening at the anterior continuous curvilinear capsule, also called the ACCC. And it is also followed by lens implantation, which has a lot of complications. Most infants never gain their normal refractive power after surgery and has to use glasses because of it. So in comparison, our new minimally invasive surgery technique removes the cataractus lens while preserving the capsule integrity and the lens epithelial progenitor cells. This preserves their regenerative potentials and allows them to regenerate brand new lenses. So as you can see in this figure, on the top left corner, you can see that as little as 6 to 8 months, the average thickness of the regenerated lens increased significantly compared to the 1 week post-operation. Not only that, as seen on the top right, its refractive power increased significantly as well. Graph C shows the visual acuity improved after surgery. And for graph D, the ability of the lens to increase its reflective power increased significantly after 8 months. For graph F, the scar tissue from the surgery was set on the periphery of the eyeball away from its visual axis, and no disorganized tissue regeneration was observed.
Thank you so much for being with us today, Dr. Maya, and describing the surgery. Earlier this week, we actually met with some of the researchers who made all this possible, and we recorded some of the things that they had to say about it.
Hello, Dr. Cassie. My name is Andrew. Thanks for having me on today.
The PAX6 gene is known to play an essential role in lens generation and eye development. We first determined that PAX6 positive lens epithelial stem cells, or LECs, contribute to lens fiber cell formation by performing a lineage tracing experiment in mice using GFP. High amounts of membrane GFP were observed throughout the lens on day 1, 14, and 30, revealing that PAX6 positive LECs are able to generate lens fiber cells. Next, we isolated rabbit LECs from lens capsules. These LECs stained positively for the LEC markers PAX6 and SOX2. After differentiation, the LECs form transparent, convex structures, similar to that of a lens, known as lentoid bodies, which hold strong refractive power. These lentoid bodies exhibited genes that are specific to mature lens fibers, like alpha, A, beta, and gamma crystallins. The current pediatric cataract surgery involves removal of the cataractous lens through a large opening and implantation of an artificial lens. The residual LECs left over from the surgery result in a disorganized donut-shaped lens. Even 4 years after surgery, it is possible to see this donut shape.
Hi, this is Eric, and we'll be talking about lens regeneration in rabbits and macaques.
I will be discussing how the BMI1 gene can affect maintenance and self-renewal of LECs. Looking at the data, you can see the effects of BMI1 knockouts in lenses of mice that are 2, 7, and 12 months old. Compared to BMI1 knockouts in the 2-month-old mice, BMI1 knockouts in the older 7 and 12-month-old mice have a significant reduction in BRDU-labeled LECs. In the older group of 7 and 12-month-old mice, when BMI1 is knocked out, cataracts develop in both eyes. So, what does this all mean? Data shows that losing BMI1 function disrupts LEC proliferation, which reduces the pull of LECs and promotes cataract formation. Moving on, I've been experimenting with the new cataract surgery on rabbits and macaques. The new method reduces wound size and moves the opening to the periphery to preserve the LEC's regenerative potential. In the rabbit, the regenerated lens tissue had minimal scarring and a clear view of the retina. Also, at 3 to 5 months post-surgery, rabbits experienced significant gains in their lens's optical or refractive power. Lastly, experiments in young macaques show at 2 to 3 months post-surgery, regenerated lens tissue grew from the periphery towards the center. At 5 months post-surgery, regenerated lens tissue reached the center, and when illuminated, lens was transparent and retina was clearly visible.
From Andrew and I, back to you, Dr. Cassie.
This technique sounds amazing. Thank you so much to all our special guests for joining us today. This new study found that when most of the endogenous stem cells in your lens are preserved, the lens can regenerate by itself. In the current treatment for cataracts, all of the stem cells are removed, causing the necessity for the artificial lens. If you know anyone who has a child in need of pediatric cataract surgery, tell them to ask their pediatrician about lens regeneration from endogenous stem cells. Thank you all and have a good night.